Hello, my name is Mona Dispani, and I'll be doing my checkoff on I am intramuscular injection today. First of all, I'm going to introduce myself, Mona Dispani, and I'm going to identify my patient, whether it be asking them their name and the date of birth or scanning them on the on the band if it's in the hospital. First of all, I'm going to make sure that I check my orders, compare it to with the Mars to make sure certain that the medication that is ordered is what's going to be given. And I'm going to explain everything to my patient, make sure that they know what's going on, and let them know, make them aware. Then, first of all, I'm going to wash my hands, make sure that I wash my hands thoroughly before I do anything. And then once my hands is completely washed, then I'm going to don my gloves so that way I can get the medication prepared. Okay, I've done my gloves. Then I'm going to be sure that I get my supplies ready. First of all, I'm going to open up the supplies for my injection, for the needle, and I'm going to use to get the medicine ready. Okay, and then I'm going to uncap the medication, and then I'm going to swab with an alcohol swab, circular motion, and then I'm going to aspirate the amount of medication that I'm going to be administering, which is 1 ml. And I'm going to remove the cap and instill the air into medication slowly. And then I'm going to invert and make sure we don't have any air bubbles in the medication. Make sure that the medicine is completely on the 1 ml. And once I completely get in the medication, I'm going to carefully recap. And then I'm going to identify my sites, which would be the ventral gluteal, which would be in the buttocks area, or the deltoid, which would be near the shoulder blade, or the vastus lateralis would be on the lateral thigh, but I'm going to use the lateral thigh, which is the vastus lateralis. I'm going to swab it, and then I'm going to administer the medication. Make sure I use the Z-track, pulling the skin taut and administering in the skin slowly, administering the medication. And once I'm done administering the medication, I'm going to dispose of it into the sharps container and make sure that I apply light pressure to the site to make sure that the medication does not ooze out of the site. And then I'm going to remove all of my supplies, make sure my patient is comfortable. I'm going to remove the gloves, remove my gloves, and be sure that once I'm completed removing my gloves, I'm going to wash my hand thoroughly. Once I'm completed with giving IM injection, and make sure that I document the site, the amount of the medication, and how the patient tolerated the medication administered to them. Thank you.